Lunch with Ed Doolan on BBC WM. Never before has local radio been so important.
Okay, gang, backs. Easy to damage. Blue murder to put right. If you have a back pain, then we have two experts in the studio today, and they may just be able to point you in the right direction. No promises, but we can try. And you can put your questions to our guests on 08 453 009956, 08 453 009956. If you would rather do us a text, then begin your text with WM, then the message, and send it off to 81333. 81333. James Russo and Dr. David Evans, welcome both.
Thank you.
Thank you.
Hello.
Good to see you. And, I must thank you for that cushion you lent me the other day.
Was it helpful?
Very.
Good.
Very. I've been a bit miserable the last couple of weeks. I've had the odd ache. And James gave me a cushion and said, try this out. And I must say it's made quite a difference. So thank you very much. Now, so that we're clear, you both work with back pain, but you come from two separate disciplines. James, you're a chiropractor, and David, you're an osteopath. And for the uninitiated, what's the difference, James?
Well, I think there are some differences, but there are a lot of things that are common to both disciplines. From what I understand, the osteopaths don't train for X-rays, whereas chiropractors do. Chiropractors have a long history of X-ray. I think the X-rays came about at about the time that chiropractic got established, so they had a lot of grew up together.
Yeah.
But as I understand it, the British School of Osteopathy and the Anglo-European College of Chiropractic have a cooperation policy, and they exchange lecturers, and I think they work very, very closely together.
Okay, David, we've heard from James about a chiropractor. What about an osteopath?
They are quite similar. Without getting too boring with it, the similarities really are that they both use a lot of hands-on techniques to deal with back pain. If we were to bring a third profession into the comparison, physiotherapy, these days I don't think it's too controversial to say that they have there's a bit of a trend towards being a bit more hands-off, a bit more exercise-based. So I would say that the two professions of osteopathy and chiropractic are now slightly more distinct than perhaps they were a few years ago, because of this, if you like, return to the roots of physiotherapy being quite rehabilitation-based.
So, David, how does somebody with, and I'll ask you the same question, James, David, how does somebody with back pain decide which treatment to undergo?
It's a tricky one, isn't it? These days, there are clinical guidelines which are really aimed at practitioners more than they are members of the public, so that it is a slight problem actually to get the message out to members of the public. Osteopaths, chiropractors and physiotherapists are largely first contact health professions, so you don't have to go to your GP first. But I have to say, there's no easy answers as to whether to go to a chiropractor or an osteopath or a physiotherapist. It's really, you'll get individuals that people trust and have good reputations and have recommendations from their peers, and probably you're best to go along with those recommendations.
Would you go with that, James?
Yes, absolutely.
Yeah?
Yes.
Okay. Almost everybody will have suffered back pain at some time in their lives. Is back pain, as both of you treat it, is it easy to cure?
Well, you know, it's if we think in terms of exercise, if you wanted to get fit to run a marathon, and you trained and you got fit to run the marathon, if you stopped training, you would gradually lose that fitness and be back in the starting blocks. And I think backs are the same. That if we have somebody's lifestyle is contributing to their back problem, and over a period of time this accumulates, and finally the straw breaks the camel's back, And they come and they get treated and the symptoms subside and they're feeling really fit again. If they go back to the old ways and neglect their back, it's bound to happen, to recur again. So what David was saying is very important, ongoing care, and especially with the patient taking care of themselves and perhaps changing a few things that they do and the way they do it.
But the trouble is, James, you never know when the damn things are going to go. And people, I'm sure both of you will have experienced this, and I'm sure listeners will have experienced this, that you get up one morning, you're feeling okay, you bend down to pick something up, ouch.
That's right. But what probably happens in a case like that, it's building up to that. And that's the final kind of straw.
Do you know that it's building up to what? Not do you know, does the patient know?
No,
that's
the thing, it's very important that we can help people, but then they have to really take responsibility and help themselves. For example, if we give exercises to try and strengthen the core muscles around the spine, it's very important that they do them. And being human as we are, when the pain is subsided, symptoms are gone, they do the exercises for a while, they think, I'm okay now. They neglect that, they go back to their old ways, and after a period of time, these things can recur. And just as you say, maybe just bend down one day and it's all back again.
James is right, yeah. Physical fitness in several studies has been shown to be one of the few things to try and avoid future recurrences of back pain. Because back pain by its nature is episodic, so it comes in episodes and then it disappears for a while, but it does recur. The biggest predictor of future back pain is previous back pain, unfortunately.
Why?
It's a hard one.
I know, that's why I got you in.
Partly because some back pains obviously are due to damaged structures, and those things stay more sensitive afterwards. The nervous system never really forgets; it never really lets you forget. And even though it stays out of the consciousness a lot, it has a sensitivity that's evident on if you look for it. Likewise, there's a strange phenomena where it's almost counterintuitive, but the body weakens muscles in the area when you've had a back problem, and even though you get rid of the pain, the muscles don't immediately strengthen up unless you work at them. So that comes back to what James said. You do have to keep your back fit.
But also, there are things we can do ourselves to relieve the symptoms.
Yeah.
Yeah.
I think the important thing is, for example, the people who work at a desk, they have to make sure that they got all the right workstation settings, the computer at the right height, the chair at the right level, armrest for the wrist rest for the keyboard, and all those things. Even then, sitting without moving for hours on end does put a load on the spine. With measurements of intradiscal pressure when seated are far greater than when standing or even lifting a weight.
Taking your calls, 08 453 009956. If you have had back problems, or if you've got a back problem and you want to share with it, maybe we can even point you in the right direction, then we'd like to hear from you right now, please. 08 453 009956. If you'd rather send us a message by text, it's 81333, 81333, and text WM before your message, and then off we go. So we'd like to hear from you. You're more than welcome to join in. Please do so. It's 26 minutes after 1 o'clock, and we're talking back pain. Does exercise, I'm sure exercise would help, but does it always help? Or should somebody just almost be immobilized until they get it fixed up again?
There are situations where exercise clearly won't help at the time. If a pain episode is actually very, very intense, so it's a very high level of pain, sometimes it is actually quite painful to exercise. Not necessarily damaging or harmful, but certainly quite painful. Almost all of the research evidence says that resting is just as bad as overusing. So rest is also not the answer. It's somewhere in between. There was one study that defies the answer that rest is the best. Sorry, that activity is the best thing, but that was a military study done in the US, which actually got people with recruits with back pain to actually march continually for 24 hours to see if that did any good, and it didn't. So one mustn't overdo, but certainly one mustn't over-rest.
James?
Yes, absolutely. Yeah, and I think of the right exercise at the right time. and the right frequency with the right kind of resistance is very important.
Okay, Rose in West Brom. Yes, Rose. Rose in West Brom. Yes, Rose.
Hello. Well, I have a problem with my back. It's about 10 years now I'm having the pain in my back. Sometimes I have to stop from work because it's just snap. And which, as what the doctor was saying, I do my exercise. And after a while, it still stops pain. And the next time, just bend, pick up something, and it snap. I can't bend again. So what is the proper cure for that?
What would you suggest, gentlemen?
Well, I don't think that exercise really necessarily of themselves will fix anything. If there's a problem, a misalignment there, or a weakness on the one side, pressure on a nerve, or there might be some congenital anomaly. What's important to do is find out what's wrong and address that problem, because back pain can be caused by a number of different causes, and to address and try to get that, if it's possible, if it's something that can be fixed or improved, to improve that, and then do the exercises, and then to maintain that. But it's impossible virtually to say what's wrong or how to approach it without having a hands-on and knowing the problem.
Have you spoken to your GP, Rose?
Yes, I did.
And what does the GP say?
Just say it's arthritis pain and give me painkiller Cojamal.
The thing with painkillers is they might kill the pain, but they don't kill the cause. That's got to be the worry, David.
Yeah, I'd say certainly if you've had it for 10 years, that's an awful long time to be just taking painkillers to, get you through the day. I would certainly get it assessed by someone more than a GP, and that's no disrespect to our GP colleagues, because their primary role isn't really to look after back problems, it's to look out for life and death situations. But I would get it looked at by someone that does a lot more of back pain care.
Okay.
Okay, Rose, good talking to you. You're with Ed Doolan, you're with BBC WM.